So good afternoon, everyone. Good morning for some of you, I'm sure more on the West Coast, but I'm Morgan Smith, the Director of Content here at ProviderTrust. Thank you so much for taking the time out of your day to join today's webinar, 3 Compliance Monitoring Trends Impacting Healthcare in 2023. Before we get started, I would like to go over a couple of quick housekeeping items. The phone lines have been muted to eliminate any background noise. If you do have a question during this presentation, feel free to type it in the chat or the Q&A section. We'll be kind of tracking those as we go along. And additionally, we will reserve some time at the end for a quick Q&A. We did receive CEUs for any of you looking for credits for CHC. That info will be included in our follow-up email. Today's presentation is being recorded and will also be distributed in the follow-up email from ProviderTrust. So be on the lookout for that later today or tomorrow. So let's jump in really quick. First things first, I'm going too quick. If you're not familiar with ProviderTrust, I wanted to take just a quick moment to give a brief introduction. I won't read through these specific bullet points, but first and foremost, what's important for you to know is that we believe everyone deserves a safe healthcare experience. And we have set new standards for compliance intelligence because we believe that's really going to lead the way in the industry. We've been doing this for more than a decade and feel like we have a lot of experience to really bring those standards up to par across the industry. We believe deeply in a healthcare system that is equitable, accessible, affordable, and free of fraud for Americans. And we support that belief by continuously innovating a more intelligent healthcare compliance monitoring system, which helps providers and payers identify eligibility, compliance, and credential issues within their individual populations. So if you have any more questions about ProviderTrust, feel free to drop those in the chat. We'd love to get you some more details. Okay, so let's dive into today's presentation. I know we're all tired of hearing about the COVID-19 pandemic, but obviously we cannot ignore the profound impact that it's had on the healthcare industry and really the world, if we think about it. Nearly 3 years have passed and organizations are still grappling with the challenges they faced when it started. However, the pandemic created additional challenges and has acutely affected the human experience. From workforce challenges to shifting consumer behavior, like much of the world around us, healthcare has changed drastically in those 3 short years. So what does that mean for healthcare compliance in 2023, right? Luckily, we have 2 industry experts here with us today to dive in a little deeper. Both with more than 25 years of experience in the compliance and risk field. I know, Donna, I see you smirking. You like when I mentioned that 25 years number, right? So today's presenters include Michael Rosen and Donna Thiel. Michael is a co-founder of ProviderTrust and an industry leader in compliance monitoring and eligibility solutions. Mike is an expert in designing and developing tools in risk management and compliance industries that tackle real-world problems that make healthcare smarter and safer. He's an active speaker and presenter at compliance, legal, and risk conferences. And prior to his journey as an entrepreneur, he served as a practicing attorney, general counsel, and president for a global background screening and identity theft restoration firm. So Mike brings a ton of great insight and perspective to the compliance issues that we're facing today. Donna is the Chief Compliance Officer here at ProviderTrust. In addition to running ProviderTrust's compliance strategy and execution, she works with compliance officers across the country to strengthen compliance programs, manage government investigations, implement and manage a corporate integrity agreement, and prepare for the various regulatory changes that impact healthcare providers. She has formerly served as the Chief Compliance Officer of a large post-acute healthcare company responsible for all compliance strategy and operations nationwide. I'm sure many of you have already heard from Michael and Donna in the past, but you know, there are our go-to teammates when we want to know what's happening and what's coming in this industry. So without further delay, I'll turn it over to the both of you. Donna, I think you're here to kick us off.
I think so. Well, thank you, Morgan, and welcome to 2023. This is our first webinar of the year, and Mike and I love having the opportunity to talk to all of you. I was just trying to sneak a peek at the participants, and I see some familiar faces or names, I guess I should say, and we really appreciate that you join us whenever we have the opportunity to talk with you. And I was smirking when Morgan was so kind to say over 25 and not a bigger number. So thanks, Morgan, for that. So today, Mike and I are just going to spend 30 minutes or so chatting about some of the industry priorities. The three we're going to focus on today are cost containment, mergers and consolidation, or mergers, acquisition, and consolidation. We're going to talk about some of the recent government oversight, certainly hit just briefly on some enforcement trends, and we'll wrap with a little summary of kind of all those basic back to the 101s of compliance that we all know are important. And like Morgan said, we'll certainly try to leave some time for questions and hopefully answers if Mike and I know the answers. But feel free to ask questions as we go, and Morgan will watch that and help us try to answer your questions in real time. So let's get moving, Morgan. We can kind of skip over that slide. So here are a couple of the priorities that we are monitoring here at ProviderTrust, and I'm sure all of you are as well. So cost containment, right? Every single day we are learning or reading more and more about the challenges that all of our providers and payers are facing, and really trying to find efficiencies and having to make some really difficult decisions about cuts. We're going to talk about that a little bit more. Labor. Oh my goodness. If you don't have something in your inbox every single morning, focusing on some of the challenges of staffing, hiring, finding folks to work in our industry, I would be shocked. Another area that, again, probably because of all of the items in number one, we're really seeing a lot of mergers and acquisitions and consolidations across the industry. So we're going to focus a little bit on what that means to us in the compliance world and some things that we should potentially consider. We're not going to talk about the PHE or the public health emergency too much, but certainly would be remiss if we didn't say that that still continues to be on the top of minds of all of us in the healthcare industry. Certain things to think about, right? What happens when the public emergency ends? What's that going to mean for us? We anticipate seeing a lot of eligibility changes in the Medicaid space. We know many health systems rely on important state Medicaid dollars. So recognizing that that's probably a priority for many of us in 2023, one that we're not going to cover today, but recognizing it is important. Another couple areas, Morgan, thank you, are reimbursement changes or cuts, depending on what industry you're in. We always see changes right at this time of the year. Some of our partners are seeing a lot of cuts that makes things very, very, very challenging. Again, we're not going to talk about that today, but recognizing that is top of mind for many of you. One of the areas we are going to talk about a little bit is government oversight. The OIG came out with a special fraud alert related to telehealth. So we're going to dig into that a little bit more. And then certainly when we see government oversight, that generally means more audits for all of us. So we'll talk a little bit about that. And then the last one, again, we're not going to talk about, but recognizing more data, more risk, more breaches. We see that every day, and certainly recognize that you are all spending a lot of time thinking about what security and how to protect the very important sensitive information that you all house and gather. So again, not topic for today, maybe a future webinar, but we believe those are a few of the high priorities in 2023. So let's just start off with cost containment, and we can go ahead and go to the next slide. So I think, I don't know if it was over the weekend or last week, there was a Becker's article that just focused on 17 health systems that had reported cuts just in the last 2 months. And I think, like, when we're thinking about cuts that are happening, we know all the organizations are really looking at cost containment. But when we think about cutting staff, or maybe it's not staff, maybe it's reorganization. So you look at some of these statistics, right? In these 17 organizations, in the explicit examples that were given, they identified over 3,500 specific positions that were cut across some of those organizations. 6 were highlighting kind of reduction in services or closing practices. When I was looking at it, we saw hospitals that are being closed, practice groups that are being closed. We saw changing from a hospital to a freestanding emergency department. One of the examples was reducing maternity delivery services in a hospital. So it's ranging from all different sorts of changes, and then really re-engineering leadership or changing corporate structure. A lot of the systems were maybe not filling open positions and just eliminating those roles in a way to try to control costs. One of the examples, another article that I was reading spoke about a health system out of Boston who had made the decision to eliminate the CEO role explicitly across all their hospitals and really consolidating into the COO role and expanding that role in trying to, reduce maybe one of the layers in the organization. So organizations today are just being very, very creative. And as that last item says, right, one size doesn't fit all. And if Chris Redditch, one of our other co-founders, was here, he would tell you kind of one of the things that he's taught all of us, right, is when you've seen one healthcare organization, you've seen one. And that is so true, right? In the world that we're facing today, we all have to be extremely creative in trying to find ways to meet our patient needs. And I think it's just important to remember, like, we recognize that these cost containment measures are really difficult decisions, and we know bring a lot of stress to each and every one of you in trying to make those patient care decisions. And we keep going on to the next slide. Another really important area as we're looking at cost containment is staffing, right? We talked about labor shortages. And when you look at your P&Ls or your bottom line, generally speaking, right, what we see is about half of the expense that a healthcare organization faces is labor. And we're starting to see shortages in labor. This particular slide talks about some nursing strikes that we've seen. We know in Minnesota back in September, I believe there were about 15,000 nurses that went on strike, almost went on strike a second time to really bolster their position on what they felt were understaffing. We're seeing that across the country. In this particular slide, we highlighted California and Oregon, Michigan, Minnesota, but it's just an ever-changing environment. One of the statistics, and I'm going to cheat and look at my notes here, is that the National Council for the state boards of nursing indicated that in 2021, there were 4.4 million registered nurses, but yet the Department of Labor only indicated that there were 3 million employed nurses. So that's just, I think, a really interesting statistic and makes you think about, gosh, how many nurses are leaving the industry? Are they taking different positions because of the stress that they're feeling and the challenges that they're faced? So we know that this is a real challenge for us. On the compliance side, I think it brings opportunity for us to think about how do we manage that? How do we think about when we have kind of that open door, people are coming and going so fast, how are we making sure people are properly credentialed? So definitely a place where causes a lot of anxiety to a lot of people within the
Donna, I wanted to add, we heard of a situation recently where someone's child needed services, went to a children's hospital, and they, for whatever reason, didn't have enough nurse or child anesthetists on staff, and ended up having to bring in from the adult side of the hospital, somebody who's trained for adults. That's scary. That is could cause, obviously, quality of care issues. Thankfully, it did not present a problem ultimately for this child, but we know that that's what's happening in the workforce. And so we look to see and expect that there'll be, pretty deep dive audits by the government or state licensing boards into, are the people that you're placing in these roles, do they have the necessary credentials? Do they have the PALS certificate, not just an ACLS, for example, if that's what's required to move into a children's or a NIC unit? And when you're, short-staffed and doing the best you can just to get the patients through their services with some type of qualified, it's not going to be defensible to say we put someone there who really didn't have a PALS certificate when in fact that was what was required. So we know that we're preaching to the choir, but these are the things you really need to be thinking about as you work your staffing workarounds during these strikes and shortages.
Absolutely. Thanks, Mike. Morgan, I think we can go to the next slide. So as Morgan said, my background is post-acute, so I stay near and dear to that part of the healthcare spectrum. And one of the interesting pieces of information that I saw just, I think, really over the weekend was something that the American Healthcare Association put forward. And this really is kind of looking at how nurses have left the industry and have changed. And so I think, again, you don't need to focus on the data in the slide, but more importantly, just thinking about as these things are shifting, right? It increases the risk to each of our organizations, and really asking ourselves from a compliance perspective, like, how are we filling these open positions? Are we really doing background checks? Are we making sure that these people are properly credentialed or licensed? Are they eligible to work? And when you're sitting in your kind of shoes, what should we be doing? You know, what's our compliance plan look like for this year? Should we be changing anything? Should we be auditing anything? Should we be asking for different data? And I just think this is an area where we have significant risk in our organizations, and an opportunity from a compliance perspective to step in and hopefully help keep eyes on reducing that risk every single day. So let's move on to the next section we want to talk about today, and that's really mergers, acquisitions, and consolidation.
Don and I are going to tag team this one. I think what's important here for us, John, if you'll kick us off on sort of with the trends that we're seeing, and then I'll talk a little bit about the private equity impact, at least from what we're reading that they're seeing.
Absolutely. And I think there's so many statistics. And when I was trying to look at statistics of how many mergers and how many acquisitions, and I think every publication I read had a different story, but it's a lot. And I know certainly in my inbox, I'm reading about them every day. Certainly at ProviderTrust, we're seeing lots of our own clients acquiring other clients or spinning off assets here and there. And we definitely see post-pandemic that things are kind of coming back into whatever normal means, right? We're definitely seeing activity in that way. We're also starting to see financially distressed sellers, right? We just talked about cost containment and labor shortages. And we all know that that means that we've spent a lot more money on labor and sometimes contract labor than what was budgeted. And so we have organizations that maybe are selling because they just don't have the capital that they need. Maybe we're refocusing on core business, right? Maybe we're spinning off a line of business that we thought would help our portfolio, but isn't quite right. So we're spinning off a whole line of business. And maybe we're spinning off some of those underperforming units to try to really make sure that our monies are being spent on those businesses or facilities or locations that are the most profitable. So I think that's what we're starting to see as trends in this mergers and acquisition market. Mike, do you want to take over?
Yeah, I'll add a little bit here to it from what we've seen in researching and talking with our law firm clients who do due diligence with us on like pre-transactional measures. If they're getting ready to acquire another company, they want to do an exclusion or license verification to make sure they're not buying into a problem, or they could put that as an exclusion in their agreement with the seller, and they're responsible for those fines and penalties, et cetera. And what we've uncovered, both looking at the healthcare finance articles that are out there that track this, and some of the leading law firms, Bassberry here in Nashville, for example, is that what's changed is what's been the same is about 15% of the consolidation or mergers last year were financially distressed companies. That's about on par with what it was in 21 and 20, which was 16%. So it's roughly the same. So 15% of what's out there being sold are distressed, which means they probably have been cutting back on staffing and potentially compliance and other measures prior to sale. And you need to know what you're buying into. What's drastically changed is the financial and liability of the private equity firm. This is new. There's a case that we'll be sending out with the documentation here afterwards. And we blogged about this in the past, where a private equity firm had purchased an organization, and at the time they knew that organization was short-staffed and staffing with people that were not licensed. And at the board level, two of the private equity funders were members of the board and were presented with and decided to implement a study on how that was, why that was happening and how to fix it. They neglected to ultimately fix it and continued to bill the government, which were all false claims. The court held not only the operating company, but the PE firm itself and two of the directors individually. The total fines were $25 million, and boards of directors each paid 5 million of that 25 million. So this is resulting from a whistleblower case, and it's filed against the PE firm directly. That's new. That's scaring and waking up the PE firms. And as far as due diligence is concerned, they're going to be looking for you to prove that the right things are in place. So this is a relatively new thing that you should be aware of. Next slide.
So I think I think this is me, Mike, right?
Yes.
Think about what can we do in the compliance world. I always think about when did I find out about these changes, right? When I was the compliance officer, when did I find out? And really making sure that you're at the table, make sure that you know when acquisitions are coming so that you have the opportunity kind of to do these last two things, right? Do you have a checklist? Is there a compliance checklist that you have together that says every single time we go through an acquisition, these are the things, these are the questions that I want my due diligence team, because you're probably not on the due diligence team, at least capturing the information. You're in that post team who's reviewing the information, but making sure that you have the right list together to give your team so that you can do a good assessment of the quality of the compliance program or the risks that your organization is considering, right, in that acquisition. And if you're going into a new line of business, right, that's really important because you know what? I don't know about you, but I certainly don't know about all the different healthcare continuums. And when it's a new line of business, there's a lot of regulatory research and considerations to do. So those are some of the things that I would consider in the compliance world as we're looking at different possibilities of mergers or acquisitions.
And Donna, let me also add, because you've said this before in our previous webinars, does compliance have a seat at the table at your board meetings? Next week, we have a quarterly board meeting with our board of directors, which includes outside investors. And Donna is presenting, as she does every quarter, and gives an assessment of what we are doing, how we're moving towards shoring up things, and gives an honest risk assessment of where things are in the business. You should be able to have that too, and it should be something that's reported directly to the board.
Excellent. And continuing on kind of what would I do in the compliance role, really like what is the standard of practice, right? When you think about exclusions and license verification and just making those folks, Mike was just talking about notice of kind of bad practices from the previous organization, right? You just want to know what's happening in that current organization so that your company can properly manage the acquisition and be clear of what the risk is. And we just talked about if you're buying a distressed asset, does that heighten your awareness? So I think these are just some good basic standards of practice as you're considering a merger or an acquisition.
We said we're not going to talk too much about the mercy declaration, but Don, any major points you want to address here, and showing a few of the points at the bottom in particular that might be of interest?
You bet. I think this one is just kind of where we're at, right? We know that the public health emergency was extended just a couple of weeks ago or last week. I've kind of lost track of what day it is in January already, for another for another 90 days. But what I really wanted to point out here, and where we're going to deep dive a bit here, is into telehealth next. And one of the things that just came about in the Consolidated Appropriations Act that was signed in December for 2023, I'm not sure you would say it was snuck in, but we know that there's lots of things that go into that particular piece at the end of the year. And one of the things is that they have extended the telehealth, I would call them flexibilities, through the end of 2024. And what that basically means, in my mind, it's giving the telehealth industry an opportunity to prove their value, right? To prove that there's not this fraud that perhaps the OIG or others are heightening or concerned about right now, because everything happened so fast, right? Telehealth just skyrocketed during the pandemic. So there's just a lot of question. And so I think this really gives the telehealth industry an opportunity to prove out their value proposition, the business model, and the good things that can come of it. At the bottom and maybe at the state level, I think it's just important to note that today there are only 7 states left that have any sort of public health emergency still in play. All of those end at the very latest February today, as of this minute anyways, as of February 28th. And California is that state that has the longest runway at this point in time. All the rest, the other 6 states all end, I think February 7th, February 15th, they're kind of in those first 2 weeks of February. So I believe in our information that we're sending y'all, there's a link to a great site that lists by state what those public health emergencies are. I think those are the highlights, Mike.
All right. So in our remaining 5 or 6 minutes, we're going to cover both telehealth, a fraud alert that they've issued, some heightened risk cases, and enforcement. Not that 5 minutes is enough time to cover those in detail, but I think you'll find the links very helpful for you. So what has the OIG come out and said? They're very concerned about telehealth, as they've identified, rightfully so, post-COVID, during and post-COVID. Most healthcare institutions adopted telehealth, partnered with telehealth. And if you want, you can post in the chat if you're one of those organizations. I'm just curious how many of you have had that experience. We don't have time for a poll, but what the OIG did in this report, summary wise, was they went to six different OIGs within healthcare, conducted a study looking across the organizations, and statistically found that in 2022, more than 37 million people use telehealth. That's a 13-fold increase over 2021. No surprise. That's post-COVID. That's COVID, best practices. And I think telehealth is not going away. It is the current and future of part of healthcare. This was $6 billion worth of reimbursements. So that's going to catch the OIG's attention, and they've looked at it and will continue to do so. We're going to give you what they think are some of the characteristics that you might look at in partnering with the telehealth provider to make sure that you're not stepping into violations of the FCA or others. What the reason that is that they've identified that there were some pretty big risks, both in billing, upcoding, duplicate claims, and they certainly looked at the high volume billers. That's where they're always going to start. They do that with pharmacists. They do that with opioid prescribers. It's always the ones that prescribe the most that they're going to look to see if they're, doing something that is potentially fraudulent. The OIG acknowledges that they don't have the programs and funding necessary for the oversight yet of telehealth, but they're looking to and putting in their budgets requests to do so. And so they've come out with what they believe is a fraud alert, which we're going to talk about next, which puts you on notice. Anytime the OIG puts out a special fraud alert, you should be reading it and rereading it, and on an annual basis, rereading it to address if your compliance plan is addressing it. We're going to talk what those elements are in a second. It is also letting you know that's what their watchful eye is worried about. So there'll be increased scrutiny. On the next slide, let's talk a little bit more in detail about what those characteristics and what the fraud alert found. So they issued a special fraud alert. Here's the link you'll get in the presentation. And it is geared toward educating you on what are the things you should be looking out for if it's potentially a suspected fraudulent agreement, in particular for telemedicine. On the next slide, we're going to talk about what those are. Now, it needs to be said on that these are not indicative. If you have one or many of these, it does not mean the partnership you have is fraudulent or is a problem. It does mean you need to be looking at it more carefully. So what was looked at were telemedicine companies, in particularly that were recruiting through advertisement free or low out-of-pocket cost items. You saw COVID tests being sold when they were provided for free by the government. You saw cases that they looked at and are public now about targeting the elderly to do genetic testing and things that weren't necessary. These are some of the things that telemedicine got involved in. Practitioner does not have to have access to medical necessity, or they're not actually needed. The services were not necessary. These are some of the things that they found. So when you look at a telemedicine company doing business with, these are the things you should be careful of. How are they compensating? Are they compensating practitioners based on volumes of service to incent the practitioner? That's a risk. That should elevate your concern about their practices. Do they only furnish items or services to program beneficiaries and they don't accept insurance from other payers? And you can see the others that are listed here. In the interest of time, these are things that would identify potential risks. But again, just having one of those in the relationship does not in and of itself mean you are in trouble. In the next slide, we're going to talk also about how this, as far as enforcement looks, these are the implications that you could be violating if some or all of those are present and you're not paying attention to them. That's a kickback in the first case where they're paying practitioners to refer people for testing, or they're going to nursing homes and saying, you need this service when you don't. This could also get your organization a civil monetary, ultimately excluded as an organization or provider, which of course is the death knell that the OIG has and will only use when it rises to that level. You could also be subjecting your company or yourself to criminal fraud, and certainly all of those are false claims. So what's changed is that practitioners have been held personally liable. Owners of those telemedicine companies, owners of those DME companies, owners of the laboratories are being held personally liable as a result of this fraud. So as we round out the fraud on telehealth, we also wanted to share with you what are some best practices under the special fraud alert. These are what the OIG says are some skeletal things that you ought to be using in the form of conducting an internal audit to determine whether you have these issues. Or are you monitoring the provider? And are you looking to see their billing and recruiting practices? Are you developing additional billing controls to prevent claims that were false claims? And or is the provider creating and conducting education that's necessary to stay above board? Increasing surveys for patients to ensure satisfaction and identify potential concerns. The patients are the easiest whistleblowers, and they're the quickest to tell you what they think was wrong or how they were contacted. And that will help you identify possible quality of care metrics and creating an audit plan to address them. So these are the things that if you read the alert, we've summarized for you, but the OIG is going to provide you with some guidance. Let's talk, as we round out today's presentation, on some quick enforcement measures. You can read them in more detail. The telehealth enforcement action was huge. This was a takedown, national takedown with all of the federal agencies and some of the state Medicaid and other authorities. In 2022, it resulted in criminal charges against both telemedicine companies, telehealth services, in particular telemarketing services, 36 defendants across 13 different federal jurisdictions. Why? Because it was a $1.2 billion fraud submitted to Medicare. And they found that the owners of these fraudulent organizations were profiting and doing all kinds of things with their money. So this was a national takedown. There's a lot on this that you probably are familiar with, but worth noting. And there was a few others we wanted to point out, and then we'll open up to questions. On the next slide, we're going to see that there was in the genetic testing laboratory cases, there was a KETAM meeting brought by a whistleblower involving a doctor and her practice. She was performing cataract surgeries on people who didn't need them, and profiting over almost $2 million to do so, falsely diagnosing patients with glaucoma, just terrible things that created a bunch of harm to elderly and vulnerable patients. You can see she was also using broken machinery and not using medically necessary standards. That's a really poor position to be in when you're approaching trying to settle with the OIG. And then there was Operation Double Helix, for those of you who remember DNA and RNA, a play on words. There were laboratory owners in Texas and Louisiana who created a big kickback scheme involving genetic testing, and they profited over $44 million and are facing criminal measures as well as civil fines. So these are no-nos. These are what people are doing. Finally, we wanted to point one thing out for those of you who are doing effective monitoring of licenses, of exclusions, of the things that you do for the best practice. This is not included in the databases, but available on the OIG site. We are not publicly shaming this group, but the OIG is saying these organizations or individuals have been investigated by the OIG, refused to sign a corporate integrity agreement or an individual integrity agreement, and therefore the OIG calls these highly risk providers. They are not telling you cannot do business with them. They are telling you they are very aware of these companies and are tracking them for compliance. So you're beginning to see a potential bad actors list, not just those who've been administratively excluded. This is hot off the press, just came out last week. So we wanted to give you these things to let you know what's happening and help you try to avoid them, I hope. In summary, it's a back to basics program, as Donna said at the beginning. Enforcement's not going away. Bad actors are not shying away. And the OIG and the DOJ are aware of it. They're seeing major big dollar nationwide fraud and they're going after it. So what should you be doing? You ought to be looking at these alerts, reading them, and then going back and testing your audit and or investigative measures internally, and maybe update some of the things that you're searching or looking for when contracting with a third party like a telehealth provider. And again, make sure these people are licensed. We know that's difficult during staff, that you don't get a break of that in the way the economy is. With that being said, we covered a lot in a short period of time. If there are any questions, we'd love to address them. And remember, you have both this presentation, the recording, and some of the alerts that will help you. We do hope this is a scratch surface to give you an idea of where we believe at least you'd be focusing some high-level review for your 2023 plan.
Yes, and I appreciate all of the registrants and attendees they've hung with us about 10 minutes, almost 10 minutes over our time. So just to reiterate what Mike just said, I know he cut out just a little bit, but we will be sending this slide deck along with the links and the recording of this presentation after. So I totally understand if anybody needs to bounce. However, Mike and Donna, do we have 5 more minutes to add in any questions if possible? So if you do have a question and you have time to hang with us, go ahead and drop those in the chat or in the Q&A. Just to kick us off, it looks like Donna, Mike, one of the last things you said on the summary was about just make sure that your licensure operations are up to par. I think one of the questions that I saw come across with telehealth and a contracted workforce, though, I know that some organizations are struggling with keeping up with interstate licensure. So what are some, any suggestions or are there opportunities to do that more efficiently? Can you guys speak to that at all?
Don, you want to go first?
Sure, I can go first. I think half of your question was like efficiencies. When we're talking about cross-border, it is really, really complicated. And I think the broader spectrum that you can look at, and really, unfortunately, time is of the essence, but understanding where that practitioner has been practicing, understanding where there are opportunities, which states allow, like in the Nurse Compact Act, where are there places where they can? You just really have to know what your state regulations are, and then understand what kind of practitioners you have, right? Not every organization has every different kind of practitioner. So focus on the practitioners that you have the highest volume of. Make sure you understand what the licensing regulations are. Or you can always call us and we'll help you with that and take all that burden away. But certainly cross borders are a challenge, and one where, in my opinion, compliance really needs to be partnering with other teams in the organization and finding who's the subject matter expert, or going outside of your organization to document it once and for all and make sure that you know what those rules are. So then you can be communicating that to your hiring team. HR doesn't necessarily, have that accountability of understanding. So taking on that requirement or that opportunity to educate HR and the recruitment team and what the requirements are will be super helpful.
Yeah, two things to add. There are specific to the telehealth, that being an emerging and new area. For those of you who are entertaining that concept or at least auditing, here's something you need to make sure that you're doing or your partner is doing. So for example, if Donna is the patient and calls in and the system needs to know that she's calling in from Wisconsin, and the practitioner that is going to be providing her with some telehealth care has to be licensed in Wisconsin, or if it's a nurse, it could be a multi-nurse compact state license. Like, it gets complicated really fast, but that is what the compliance has to do to ensure that the practitioner is licensed in the state in which the patient is providing. And the laws are evolving in this area because traditionally it's been based on an in-person visit where you can see, touch, and or have face contact with the patient. That has had to be broadened with telehealth because that's what the technology brings to the table. But it therefore is under major scrutiny and interpretation state by state as to what that means when you by not being in person, but being able to see them online. So it varies by state. The second thing is there is an interstate medical compact that has come out in the last 2 years that involves physicians. So you have a nurse practitioner or nurse compact act, and you have now a medical that a good number of states are participating in, not all, that you need to be checking. These are the things that we know where to go when our clients ask us. But if you're not using a third party, the onus falls on you to know those things.
Great, thank you. We had one more question come in and then we'll wrap. Can the provider work remotely from another state if the patient is in a state where they are licensed?
I'm not the lawyer in the room, and I certainly don't want to give you legal advice,
Yeah, it
but I
depends
believe
on
the
the
answer to
state.
that is yes. I believe that's accurate.
Yes, but it depends on the state. So
Yeah.
again, it comes down to, believe it or not, the interpretation by that state of an in-person is what a lot of it calls, or the ability to see and touch a patient, and how they water that down for telehealth. So it is state specific, but yes, and I think this is going to change over time. I think it's going to become a more uniformly regulated, but at the moment there's no federal regulation on that. It is state by state.
Awesome. Well, thank you, Mike and Donna, for all of your special insights. I know that I appreciate it, and I hope that all of our attendees really have some great takeaways as they continue to map out the rest of 2023 and prioritize. So for all those still on the call, thanks again for hanging with us. We'll be on the lookout for some follow-up communication, and I hope everyone has a great Wednesday afternoon. Thank you.